record button and we're off to the races, so you guys can get started.
Okay. Roghayeh, shall I share my slides?
Yes, please.
Okay. Now, can you see the slide
Yep.
full screen now?
Perfect.
Okay. Yep. So welcome all. We're excited, actually. Rory Gandungkar and I are excited for this webinar. Roghayeh, can you start introducing yourself, and then I will introduce myself. And
yeah, thank you. Good morning, good afternoon, and good evening, everyone. My name is Roghayeh Gandomkar from Tehran University of Medical Sciences. Actually, I come from Iran, a country in the Middle East. I am a medical doctor, and after working as a general practitioner, I started a master course in medical education and then a PhD in health profession education, both of them at Tehran University of Medical Sciences. At the moment, I work in this university as a faculty member, and I'm the director of the Department of Medical Education. I'm very delighted to have all of you here and hope you enjoy this session. Thank you, Olle.
Yeah. So, and my name is Olle and Cate. I'm from the Center of Research and Development of Health Professions Education at University Medical Center in Utrecht. And I had the privilege actually a few years ago to meet Roghayeh during an AME meeting. And we have been in touch ever since. To my surprise, actually, I didn't know much about Iran. I didn't know much about health care or education in Iran. And to my surprise, actually, there are many people actually are pretty active in health professions education on a scholarly level, including Roghayeh. And when she suggested to me to collaborate in a project, I was actually pleased to see whether we could proceed with something that she had started with one of her own mentees as a master student in actually the topic of entrustable professional activities for PhDs in health professions education. So let's proceed with an introduction. Oh, let me see. How do I? Here we go. Here we go. So the agenda for our webinar has 5 components. We start with a little bit of a background introduction about PhD degrees in biomedicine and health professions education and the training and scholarship. We will then proceed to doing a breakout exercise that will introduce, and basically with the general question, what are reasonable expectations for scholars with a PhD in health professions education? Then we'll do this breakout exercise about 10 minutes, and Gary will put us into random groups of 3, and we'll specify what the exercise will be. And then and Roghayeh will explain 2 studies, actually. One of them I was not involved in, the second one I was involved in, and what we did in around identifying EPAs for health professional education scholars, which is, of course, different than EPAs for clinicians. And we'll end with a plenary Q&A discussion. So health professions education scholarship, and most of you might acknowledge that this is a popular topic in the literature and increasingly popular. There is a lot of papers written about that. This is one on doctoral programs. How many do we have and what do they look like, by Ada Tekian. I was myself involved in writing about what PhD thesis in health professions education are. This is another interesting article about how health professions educational graduate programs can serve continuing professional development. This is about careers, and of course, a PhD in health professional education is a typical career step for academics in medical education. This is a recently published paper that I was asked to write, invited to write, and I spent time on the history of scholarship in health professions education, which actually, I would say now has matured into, I would say, a discipline in its own right. It appeared in an odd journal that you would not expect, the Phase B Bioadvances. One of the co-editors or associate editor is Jim Williscroft, who has been active in medical education for many years too. And of course, you might be aware of the series of papers about health professional educational scholarship units. A lot of RPO actually pulled many people together to write about that in a series of papers. This one I recently encountered. Actually, it's a nice paper showing actually that some people acknowledge what professional scholars or educational scientists are and what they can be used for. Others have no idea, actually. So it's either my right hand or we barely make use of them, how those people actually are being used in curriculum development in health professions education. So I think it's a timely topic to think about what are the expectations for people who have been trained in scholarship in health professions education, either at a master or in our case at a PhD level. So if we think of health professions education, what are we talking about quantitatively? Yeah? So how many do we actually have? If we don't know exactly, the picture that you see on the top right is actually taken from a paper of about almost 10 years ago, where we showed that in the Netherlands, there was an increase of doctoral students in health professions education, and a quite steep increase, almost like over 10 years ago. And that increase has even gone through. So in the Netherlands, we have many, many people actually who pursue that. If you look at the literature, or in this case, the FAMER website, you'll find that there are, some years ago, 139 master courses in health professions education and 26 PhD programs. And I actually think that's an underestimation. I think there's more than that. And the largest PhD program, which is the Maastricht program, who attracts many international scholars, had in 2020 already 100 enrollees in that program. So these are massive numbers. If I would compare that in the time that I had my PhD in health professions education, was 1986, I think in the Netherlands, we had like 3 of them, or maximum people who are busy with that. And if we look at what we kind of did just for fun, look at what we could find as advertisements in the listserv of Dr. ED. And we actually, if you look at that, if you have that, if you're listed on that listserv, you would see that every week you'll see vacancies, and vacancies with like MHPE or PhDs in HPE are highly recommended or even required for those vacancies. So then the question is, why do people actually do that? Why would a person want to do a PhD, get a PhD degree in health professions education? And what difference does it make if they have that? So reasons to pursue a PhD may vary. So some people would say they provide a general further academic development. Whatever I do, I want to have a PhD degree because that really deepens my sense of usually like social science research in general, or my academic development. If I'm an academic, I really want to get that highest level. to enhance skills needed for a job. Sometimes if you really think you really need that, or your employer thinks you need that, you might think, let's do that because I will probably get those skills that I really need. Or just to have an advanced degree, a title of or a status. Interestingly, I'm increasingly involved in international comparisons. And we in the Netherlands, for instance, that may be very new for you, but medical doctors in the Netherlands are not allowed to have DR in front of their name because they don't have a PhD degree, unless they have a PhD degree. So if they do that, they can put DR in front of their name. So many medical specialists actually do that. And I wouldn't accuse them of only doing that because of the title, but it really helps them to feel they're more like a mature medical specialist if they have that title and the degree and the status that comes along with that. Some people really like to switch careers, or that, like, they would be a health professional and like in their mid-career phase, they would think, well, I would like to spend more time, more deeply into a scholarship of health of education, and why not do that through a health professions education scholarship program? I quite a number of people that I know actually do that at that time. And of course, if you are already part of the community of HBE scholars, it might, for your sense, you might feel more credible if you have that degree too. Actually, we don't really know what most PhDs in health professions education do in practice. We don't know how they spend their time, how much scholarly work they do, or whether they do very different things. We know of no surveys that or studies that have studied that. But if you look at advertisements, this is just happens to be one random sample recently posted on Dr. ED, the director of assessment in this case, a PhD or EDD strongly preferred. And what do these people then do? They are supposed to be coaching faculty, staff, and learners for the implementation and use of assessment tools, leading a curriculum team, developing and reviewing and refining formative and summative assessments, designing and maintaining databases, using the performance metrics and analytics to ensure evidence supports assessment, et cetera, et cetera. So if we actually look at those ads, and we didn't make any systematic overview of them, but we did just took one sample of 1 month, just October, or even less than 1 month, 3 weeks, 7 ads. And what is basically what we found, they were asked for assessment, for research and scholarship, for database management, for curriculum and instructional development, and for program evaluation, and for faculty development. And now I need to be able to read the bottom of my slide. Anyway, so you read it probably, but it's, let me go back here. Yeah. Okay, here. So the question then is, if we think of EPAs, and when I was invited by Roghayeh actually to join the study, I was interested because it was about EPAs, but the question really is EPA a useful concept for scholarship? Is evidently different than EPAs in medical care, where things are very clear, and it maybe not as clear. So again, and this may be familiar, but let's define what EPAs are: units of professional practice. You could think of it as tasks or bundles of tasks that may be entrusted to a learner to execute and supervise once he or she has demonstrated their acquired competence. But there's differences with health professionals. Entrustment decisions may be less critical, if as an educator you're not doing things, students won't die if you or maybe mentees won't die, whatever you're doing. Or you could say that PhD students do have supervisors in their education, but the supervision as a concept might be somewhat different than in healthcare. There's not an equivalent of what you could call the patient in the assessment equation. So sometimes in healthcare, we'd say, why is EPAs as an approach to assessment actually combines the recognition of ability, the right to actually do things, because it approaches the idea of licensing and also the duty to care for patients. So that might be a somewhat different approach if you use that for scholarship. So entrustment decisions really imply the trust that the learner or professional will come to an adequate action or solution. I want to just explain that a little bit. If you would take an entrustment decision, you're trusting a person to do something. It's not that you can predict perfectly what they will do. Because you're trusting them, it's not you're prescribing them into detail, but you're actually trusting to be able to do something and to bring that to a, I would say, good end or solution. So adequate action that may also include creatively organizing the right help on the right moment. If you don't know that, you can solve that, but you know who to ask for help. You might still bring that to a right solution with the right outcome. Maybe the outcome might be even more important than the process. You might have used different ways, different routes to Rome, as we sometimes would say, for an outcome. So if you trust a person, doesn't really mean that you're prescribing in detail what they do. So entrusting a PhD with the HPE scholarship task may not be identical with requiring full personal mastery. If you would say this PhD person is trained in a specific domain or specific techniques with specific supervision, now we're asking them to do something that they were not trained in, but we might want to trust them because they've matured enough that we think they could also tackle that other problem. So our research question in the studies that Roghayeh will explain to you were basically can be summarized somewhat. So EPA may be viewed as job expectations, not necessarily as required curriculum objectives. So our question for the Delphi study was not which competencies should all PhD in HPE possess, or maybe even not even for which EPA should all PhD needed their competencies, but rather which tasks or EPAs can PhDs in HPE expect to be asked to do unsupervised. So, or for which task or EPAs can employers reasonably ask PhDs to do? I think it's still a very relevant question because it gives probably a deeper understanding of what a PhD is, or what expectation of different groups could have for that. So now we will ask you to do a breakout exercise, and we'll give you about 10 minutes for that. So if you go to the chat, if you're able to access the chat, and you take the second link that I posted and download a Google Docs document from that chat link, you'll see a series of possible EPAs. And I can tell you, it's part of a phase in our Delphi study. It's not the end phase, but it's a phase in between in the second round of that Delphi study. Those 18 potential EPAs, if you look at them, we're asking you to do two things. To pick, one is to pick the 3 most relevant for PhDs in HPE, and then pick the 3 least relevant for PhDs in HPE. It might be not so easy, so we'll put you into groups of 3. Just take your time in 10 minutes to have a discussion of what your priorities would be, and return after 10 minutes. So if you have difficulty downloading that from the chat box, there's one alternative that you could do, because the next slide, this is slide, can you see 18 possible EPAs for health professionals? you can take a screenshot of this because this is the only thing you really need. And we're asking you to pick 3 that you would think would be included in those that would end up also in our Delphi study, and 3 that you might consider maybe not ending up at the most relevant EPAs in health prevention education scholarship. So far, so good. Any questions about this exercise? I don't hear anything. Is there? I can't see you all.
I haven't seen anything. I can push everybody out to the rooms.
And I can stop sharing my screen now. And if you want, please put everyone in a breakout room, and
Sounds
we'll
good.
give you 10 minutes. Yeah, give you 10 minutes.
There we go.
Oh, Olle were joined to the.
He
chat
joined
room.
one as well.
Oh, really? Man. Because I talked with him and yeah, I would join too. Oh.
Okay. All right. Perfect. Find this person.
Oh, hi, is everyone in breakout rooms?
They are. I can push you into one if you want to, Yoni. Hold on a second.
Thanks, Gary. How are you?
I'm doing great. All right. Used to doing that stuff. All right, there you go.
Brilliant. Thanks so much.
We're not hearing anything.
Unmute. Yeah. Sometimes when you go back. So I was just saying that if your group was just as nice as the group that I was in, we had really nice introductions and chats about PhD degrees in general and internationally, but didn't finish the whole exercise. And it really doesn't really matter. So but this I can tell you actually, when we in one of the steps of the exercise that we did in the Delphi study, we found consensus on relevance for PhDs in HPE higher than 0.8 for everything that you see in white, and lower than 0.8 for everything that you see in blue, which doesn't really mean that they're not relevant, but somewhat less relevant. So if your discussion were in this direction, and I recognize some of the discussions in my group were in this direction, actually, then it could be said. It was just to tease you to think about this a little bit. And Roghayeh, I would like to invite you to start explaining what we did. So would you want to share your own screen, Roghayeh? That might be easier than me continue.
Yes, if I may. Yes,
Okay, I'll
if I may.
share my screen then.
Yeah, thank you. Yeah, is it okay now?
Yes.
Sorry. Yeah. Hello again. Can I start?
Yeah, it's perfect.
Olle?
This is
Thank you.
perfect.
Thank you.
Yes.
Thank you. Hello again, everyone. During the next 15 minutes, I would like to share the results of 2 studies to identify EPAs for PhDs in health profession education. The first study was Iran National Consensus Study, and the second one was the International Consensus Study. I would like to thank my co-researchers, Reza Zairi, a master graduate in health profession education at Tehran University of Medical Sciences, and Professor Olle, Cate, who supervised the International Consensus Study. I would like to acknowledge all experts who were willing to serve on the Delphi panels. Let me explain a little bit about the background of HP PhD in Iran. The first HP PhD program started in 2010 in Iran, and at the moment there are 5 departments for HP which offer this program across the country. Actually, as the HP is an emerging field in our context, maybe like many other countries around the world, it was a debate for us that what is the required skills and competencies of HP PhDs. To respond to that, in 2015, we developed a competency framework for HP PhDs. And after that, we decided to develop the Entrustable professional activities for HP PhDs again. So we searched the literature and we found actually limited studies on HP PhD. Olle shared some of these literature on his presentation. We only found 1 study related to EPAs in master program in HPE, which was belonged to the Michigan University. So we decided to conduct 2 consecutive studies. The main aim was to develop EPAs framework for HPE PhD graduates. The objective of the first study was to identify and reach consensus at the national level in Iran. And the object of study 2 was validate and reach consensus on EPAs at the international level. In Iran, we conducted a modified nominal group technique to elicit the EPA titles at first. And then we developed the descriptions for the EPA. And after that, we conducted 2 rounds of a modified Delphi survey to reach consensus among the experts. Our expert panel were actually HPE PhD graduates and the members of the board of HPE examiners. The study lasted between July 2019 and July 22. As a result, we identified 92 initial EPAs during the brainstorming phase of the nominal group technique, and it reduced to 27 during the abstraction phase, and the final EPA framework consisted of 24 EPAs arranged in 3 categories: research and scholarship with 6 EPAs, educational development with 11 EPAs, and educational management with 7 EPAs. All EPAs had the scores, consensus scores, 80% or higher. In this slide, you can see the sample of EPA with its elements. Actually, there was a title, EPA description, a specification, limitation, and potential risk in case of failure. For the international study, we used the EPA framework developed in Iran and to seek a generalized validity and a wider consensus for suitable activities for PhD HPEs. We followed 3 rounds of a modified Delphi survey with 19 international experts between September 22 and May 2021. We targeted SCRME members at first with an open invitation through listserv of SCRME, and then we approached experts who were involved in HPE training from different geographical areas. The final participants were from the US, the Netherlands, Germany, Australia, Canada, South Africa, and the United Kingdom. We considered the content validity index, or CVI, at the level of 0.8 or larger than, and consensus percentage larger than 80%. I will explain the Delphi round in more detail in this slide. Actually, we developed 5 saved questions for each EPA for the first Delphi round. The question concerned with the relevance, clarity, comprehensiveness, and appropriateness of the different parts of the EPA descriptions. And in total, we had 120 questions for 24 EPAs for the first Delphi round. And the answers of 60 respondents were analyzed for this phase. The full survey was repeated for the second phase because we made major revision in the titles and the contents of the EPAs. And interestingly, there were some, we felt some needs to clarify the significance of EPA for HPE PhD program versus HPE PhD graduate based on the comments that we received from participants. So we added 3 extra questions for the Delphi round 2. I will discuss these questions later. And overall, we had 144 questions for 18 EPAs for the Delphi round 2. And round 3 was actually limited, and we had 1 question per EPAs for the adequacy of the EPA description, and some extra questions for EPAs that had CVI lower than the threshold during the second Delphi. In overall, we had 28 questions for 17 EPAs for this round. Again, answers of 15 respondents were analyzed for this phase. In this slide, you can see final EPAs for the international study. We had 17 EPA titles categorized in 2 domains, research and scholarship, and educational development. And the EPA framework consisted of the EPA titles and justification, specification, limitation, and potential risk. Actually, all of the EPAs had the threshold of 80% consensus for the adequacy of description during the round 3, but 14 EPAs scored the threshold of CVI 0.8 during the round 3. You can see the 3 EPAs in blue in this framework that had around 0.7 for CVI. For the next slide, I will discuss about the extra questions that we added in the second Delphi round. And these questions were, is it desirable that all HP PhDs can be trusted to do this without supervision? Do you believe that current HP PhD can be trusted to do this without supervision? And should this EPA be included in HP PhD training? And the result was interesting. Actually, 50% of the participants mentioned that 16 EPAs were desirable for HP PhDs, but they mentioned that just only 5 EPAs were EPAs that current HP PhD can do them without supervision. And also the expert mentioned that 11 EPAs were core EPAs for training. For the last slide, I would like to reflect on in our experience. Actually, this was the first experience in developing EPAs in HP PhD, actually developing and discussing about the activities that we expect from HP PhDs. We recognize different views on the expectations of HP PhDs among the participants. It was very interesting. For instance, some experts mentioned some EPAs were eligible for master in health profession education. And at the same time, other experts mentioned the same EPAs was okay, was fine for a postdoc in health profession education. So we recommend that we need more studies on the job analysis of health for HP PhDs. So the framework that we developed during this study had the potential to advance HP training across countries and to inform employment decisions. We think that more studies we need to be conducted on the utility of EPA framework. Thank you so much for your attention. And now this is the time for question and answer. Olle, please.
So what we could do is that you stop sharing your screen.
Yeah, thank you.
Yeah, that's nice that we can see everyone. Yeah, perfect. Yes. So basically, what we would like to do now is just have an open discussion about what is the usefulness of EPAs for health professions education PhDs. Is it a useful concept? Should we? We're writing this up, so we'll submit it as a paper. But it's still, I would say, something different than an EPA for health professions or health professionals. So yes, why don't we just look at the hands? So Chris Mooney,
Sure. I think Maura actually put their hand up first, so maybe
go ahead, Chris. I'm happy to go next. Thank you.
Okay, so I don't know if it's really a question, but more of something I'm struggling with, and is that it's kind of stemming off of the the Delphi process, asking people about the ability to do this with supervision. And I guess I'm just kind of, that doesn't seem to sit well with me for some reason. I mean, I think quality is somehow baked in there. This notion of kind of independence over collaborativeness. I don't know. I'm just kind of, I don't have a well-formed question, but just more this notion that it's this weird value judgment. I don't know.
Yeah.
If anyone else wants to kind of comment or if they're thinking similarly.
Actually, that was similar to what I was thinking as well, Chris. Maybe I can elaborate a little on my thoughts around it. I know I've been to some interesting discussions, I think at Amy, around the idea of how with clinical EPAs that collaboration is such an essential part of clinical work, and how that's looked at as far as EPAs. And so I was thinking about the same thing related to this. I mean, I'm about to defend my PhD, knock on wood. And one of the critical things I think I've gotten out of it is recognizing my strengths and limitations, and the importance of bringing together interdisciplinary, interprofessional teams around HPE, either education or scholarship. And so I noticed that seemed to be missing. So I think you and I are maybe thinking about the same idea in a way.
Yeah, if I may reflect on that, and Roghayeh, just feel free to add to that too. I find that a very legitimate question about supervision. So I actually do think the notion of supervision is somewhat different here. It's different than in clinical. But I would just imagine if you would be an employer, you would say, well, I'm at a school that we're going to critically revise our curriculum. We need someone actually to do this, and you could just ask them to do this, and you would say, supervision, I can't provide them supervision, so they have their own expertise. So they will, and they will work in a team, of course, but they have their own expertise that we think we need. So to some extent, you could say this, it's not like we have no educational supervisor for that person, because they're supposed to be mature and doing things by themselves. But I'm happy to hear anyone's reflection on the idea of supervision.
But I think like that's still that's vague though, right? I mean, it's like, you're still kind of making that decision based on some outcomes, however they might have been qualified or quantified, right? If it's one ability to publish, to kind of see some project through its end. So it's still kind of it's conditional on something else. And so just this notion of supervision just seems to be very kind of 30,000 foot, just kind of vague to me.
Anyone chime in about this? John, you're unmuting.
Yeah, well, I'm trying to sort out what supervision means as well. I mean, I always had a supervisor, right? I mean, you always reported to the associate dean or even the dean. So you did work, you did have to work with supervisors. They don't necessarily are on your same level, they have different levels of expertise, I guess. So, under supervision is kind of sketchy to me. That's all.
So let me give just one example. And then
You
I'll
might
give
want to look in the chat, Olle. There's comments
Okay.
in the
Yeah, sure. But if I start it's always difficult to be in discussion and also look at the chat at the same time. Anyway, so I can give one example. There's one PhD student that I actually now have. And in this case, we have pretty explicitly said, your final study, we would like to see how you actually do that all by yourself. You can ask us for a consultation, but we're not going to guide you in detail. And she actually just submitted a manuscript for submission just to us as supervisors. And actually, it really felt this person is now becoming like an independent researcher, not needing like the supervision that you would provide as the doctoral supervisors. And Alice, I'll come back to you, but Martin had his hand on, so why don't you add to that, Martin?
No, but Alice, if you want to comment on that thread, mine's a little bit tangential. So.
No, go ahead. Go ahead, Martin. It's okay.
I was just wanted to point out the tension between standardization and having, sort of something reliable across PhD programs versus diversity and, in what we would hope would be a creative endeavor, research, meaning sometimes weird is wonderful, and then the thing that's way off base and non-standard and from left field, too many baseball metaphors, but is out of favor right now, and the person's way of thinking may not be, I'm wondering, EPA-able in the immediately, and yet be the thing that makes that person a special contributor to our field. And recognizing again another tension, and it's in the chat, around increasingly really good research is becoming team-based, and no individual can necessarily do that. And yet I do think that there's going to be a yin and yang between kind of what one stellar free-thinking individual contributes versus our community leveling groupthink moving the entire field forward. And so I tossed that out there, this idea of tensions and valid tensions and how you bake them into a collection of 18 EPAs.
Martin, it's Alice. Can you hear me?
Yes.
Yes.
I think your concept is great, but I have to say that the creativity comes from the individual. The individual really is core to that creativity, the champion of the research idea or whatever they're doing. Without creativity, they're more stagnant, they're not dynamic, they're more of a follower. So for this high level of education, we want creativity. So I'm agreeing with you. But I don't think the creativity limits some type of structure that they work in, like Olle, I think, is implying. Really a structure of, either coursework or process or both, and that they need that structure, but they need to be prompted by the mentor of the work, whoever that is, the coach, the mentor, whatever we want to call them, to have a arena for that creativity. And to me, that's when you get the best quality project out of people who are doing this as a second career generally. I find most people pursuing these things are in a second career or an add-on to a first career, something. So that's just my thought process. So I love your word creativity, but I think it goes with structure. I think there's that dynamic.
It's interesting to see some of this discussion actually that we had also in the discussion section of this paper, because if you would think of EPAs for like a general social scientist or somebody with law or from the humanities or so, would be very, very difficult to predict what they will start doing after they graduate. Here, and this may be somewhere in between, because there must be, you could just expect we need a researcher that will also guide research, or we need a curriculum developer or whatever. But I do acknowledge that there's probably much more individual differences, and standardization will be very difficult for individuals. But still, and to reflect on one of the points here about working alone or under supervision, I think that's a little bit of a false dichotomy, because I do not think that if you don't have supervision, you need to be working alone. So so that holds for EPAs in healthcare too. You're never working, you're working in a team. But what you don't have anymore at a certain point in time, you don't have a supervisor that supervises you on the things that you need to do. You could say, well, we're hiring you to actually work in a team and have your own expertise added to that team to do things. But at a certain point in time, we need you to be sufficiently not dependent on a supervisor. So I saw two hands. Satit?
Oh, thank you. Actually, you just spoke my mind. That I think this concept of EPA probably have very little to do with working alone or working as a team, right? And when I entrust someone like my mentees who become the faculty, if I trust that person, I would say that that person could is ready to mentor or coach junior faculty and or leading some direct some kind of research unit or something, right? The second point I want to bring up to attention is that EPA is more than just the capability of doing something or produce a product, right? When I trust someone to lead the project or become the director of the research unit, I would want to see that that person also have know their limitation, have humility, and also open to learn from others, and also more importantly, have integrity in their research practices or educational development as well.
So I do recognize some of the elements that we had in our publication on a rich entrustment decision. So Maura?
Yeah, thanks for letting me comment again. You know, I think the concept of EPAs is highly relevant to this, and didn't at all mean to suggest that it didn't fit with health professions education at a PhD level. And your comments about if a dean were to hire you or so forth, they want to know that they can entrust you to do the work that they're hiring you to do 100%. What I think, though, should be added is, and maybe almost as a thread throughout many or all of the EPAs, is actually the concept of being able to organize and lead teams. Because I think the way they're written right now, it really does look like the individual can accomplish all these things, and maybe they can, but I think it's just a critical piece that seems to be missing. And I know from my own PhD experience, it's something that I wish I had clearer insight in the beginning of this journey about the importance of being able to identify the right team members for my research and know the things that I needed to do, even as a PhD candidate, to organize our team. I mean, some of those decisions around authorship and accountability and all of those things I think are really essential for one to develop in a PhD program, such that when they get done, they really can organize and lead teams around health professions education.
Yeah, really good points. And you could say some of the work, and when we talk about teamwork and collaborations and in clinical EPAs, sometimes we would say it would be a requirement to work together with other people before we would entrust you to do something. If we would say you have to do a study or a needs assessment or whatever, rather than say there's one EPA which is teamwork, it's actually much of that is teamwork. Hardly anything you're not doing together with other people. There might be some things, many things that if you'd say do a study, you'll have to organize so many things that require other people too.
May I say something? Olle? Sorry.
Yes, go ahead. Yeah, Roghayeh. Yeah.
You're right. We have the collaboration and teamwork in the description of maybe most of our EPAs. Actually, we can share the EPAs and its description later with participants. And for most of them, one part of the description is the collaborative work or something like that. And we don't have any EPA specifically for teamwork, but teamwork and collaboration is part of the most of the EPAs. And I think maybe collaboration or teamwork somehow is a competency because we have in our competency framework the competency named as the collaboration and teamwork or something like that. Just I wanted to add that this part is very important, and we add this collaboration and teamwork into the description of the EPA. Thank you.
Yeah, I guess you can think of it in a way that if you would be an employer and you would hire a PhD, you would not hire a PhD to collaborate just like that, but you would hire them to do a study or to do build a research program or to mentor other people, or but just collaborate would be rather part of or requirement actually, that part of the element of doing that EPA than EPA is.
Sorry.
So Cate, did you still have a new hand up, or is that your previous? Okay. And John, where are you?
Yep.
Here you go. Yeah, you had a new hand, right?
I did. Just a tangential comment. First of all, I was a part of this expert panel, so you might take these results with a bit of a grain of salt. But when I saw the list during our breakout group, I was with Rob and Sarah. It struck me that many of these EPAs could be handled by a master's level person. I mean, I've worked with master's level MEHP students at Hopkins for a long time, and I would entrust them totally to do curriculum development and program evaluation, and maybe even assessment, which is a little trickier, of course. But the core of the EPAs for PhD is really the research. I mean, that's what you're trained to do, I think. I think those 3 or 4 things are pretty essential that are from that list of 18. But when I look at the rest of them, I go, but a competent master's level person could certainly navigate through a curriculum development process, I would hope.
Yeah, so John, thank you. So we heard this from panelists that actually reflected that same. So what's not really clear in masters and PhDs that some masters do a PhD afterwards, some do a PhD without a master's.
Yeah.
So if you would hire a person, would you think that would be already included? Or would you say, well, you have no master's but a PhD, so we wouldn't expect you to do a program evaluation? Yeah, it's still a little bit unclear. Yeah. Yeah.
I mean, the master's is a practitioner, right? I mean, theoretically. So,
yeah.
I mean, I can reflect on the curriculum that I work with, and are they going to be an expert in it? Maybe not. Maybe they can ask the right questions and know where to get the answers to. But anyway, just an observation.
Yeah. Very legitimate, though. Gary?
I raised my hand mainly because I want to make sure Doreen's question doesn't get overlooked in the chat, because it's one that's come up a couple of times, which is how do you think EPAs will shape existing or new PhD programs?
Yeah. Thank you, Gary. So it's again that multitasking. I that's not my EPA. So it's good that you just mentioned that. So there's different ways. If you Doreen, go ahead. Yeah, explain it. Yeah.
Yeah, that was just sort of a question that came to me thinking, I don't really, I'm a PhD supervisor for some folks at Maastricht, and I teach in Penn's Masters in Med Ed. But my own PhD is in public health. So I'm wondering, you know, I come at it like Christina, sort of a different, more non-traditional. And so I wonder then how do we have to shape, or how might, not that we have to, but how would this influence if these EPAs become embraced by the discipline or the field, however you want to think about it, that we then shape our pipelines.
Mm-hmm. So, Roghayeh, would you like to reflect on that too? What is your long-time vision of using this framework?
Yeah, very good question. Actually, we are thinking about using this EPA for the assessment of our PhD students. Actually, we are at the beginning of the path, and we are not sure how we can insert it in our assessment system. But I think our next step would be inserted in the assessment of PhD students and develop a system of assessment. Yeah, or we can introduce it to the supervisors and educators, and maybe they can use it for their teaching or something like that. But I think it would help us for the assessment. But from another point of view, actually, I work in the units where we hire the graduates of HP PhDs. I think after that, maybe this framework could help us to how to hire them and employ them. Maybe it can provide a framework for hiring people. Actually, recently we hired 3 PhD of health profession education in our unit. and now we can see, for example, some of them can do some tasks that we expect from them independently, and they need coaching or maybe supervising during those tasks. Yeah, I don't know, maybe our setting is different from other units, but I think any PhDs do some educational development projects. And for that, I think this framework could help us to hire the appropriate scholars. Yeah.
Thank you. So again, if I like to add to that, so personally, if I look at at our program, the PhDs that we are training, I actually think this is rather aspirational than really something that we could use for assessment across all those EPAs, because I don't think many of our candidates would actually meet those standards. So it is, but the aspiration is useful too. So Doreen, to answer your question too, what I would like to do is just give them just a list to people and say, what do you think of that list? How much do you think you would be able to do without minimal supervision, and where would you still want to, and what's your aspiration? What would you like to do? And maybe it should be something that we're not aspiring to do within like 4 years of training, because we will not be able to make you an expert in all those domains, but it could be still aspirational. So even afterwards, you could say, well, maybe I could use that just to train myself or to develop further. But it gives a little bit better overview than we have now, actually. So the students that we are accepting now have really little idea of what they will be doing with that degree. So that's probably how you could use it. I really like the question, and Roghayeh, if we finalize our paper, we might add that to us as a suggestion at the end of the discussion section. Yeah.
And there were a lot of questions in the chat box, Olle.
Yes.
I don't know.
Feel free to speak up if you want to, because I can only see a section of that. I have to go back. And other people are actually also leaving. Deb Simpson had a question, but she's gone, I think, now.
That was interesting that Mora asked. I was surprised there wasn't more agreement around leading educational strategic projects than policy development. Yeah.
Yeah, well, that question. So what did we lose actually for EPAs? Because we started out with 24 and we ended with 17. And we did lose some of them that have not a high level of consensus as relevant for PhD. But basically in Iran, I think strategy, management, and policy was much more prominent, right, in your EPAs. Roghayeh,
yeah,
is that true?
exactly. Yeah, exactly. And another thing would be we had a limitation in our international study, and that was that we invited experts that were mostly involved in the training of HP PhDs. Maybe if we conduct a Delphi with for example, graduate of HP PhD, I don't know, maybe there was a little difference, maybe. But as you mentioned, it's related to the difference between the contexts. Yeah, you're
right. Chris, do you want to?
Yeah, sure. So this is, maybe it's building off what Alice had said earlier, where she had talked a little bit about kind of that a bulk of PhDs in HPE don't do research. They're tasked with a lot of other duties, much like you're describing now. But one of the things I think, that folks in SDRME often talk about is the challenge of being a PhD in HPE, where we become generalists rather than being specialists, right? And that we're doing so many different things. And I wonder if even having, how much will something like this perpetuate this idea that we have to do all these things to be a successful academic, PhD in HPE versus, could we think about it in a different model that's going to be a bit more reductionistic, that won't kind of perpetuate this, we have to do everything. So it's something that I'm, it's struggling with in terms of not that this is harmful, but if it's just kind of perpetuate that notion.
Yeah, that might be true. I think it's a good point for discussion. Sometimes when I talk with PhD students or people who are doing research, I would say to them, it would actually be good to actually do some teaching, do some curriculum development too, and not only focus on a narrow area where you're probably the expert, but you're doing something for a training that has a wider significance. So I know educational scientists who do a lot of research, but have never really taught in a classroom. And I find that kind of difficult too, because they have difficulty to bridge that gap. So some sense of generality combined with expertise in a domain is probably a right compromise. Yeah.
I like that answer.
I do feel that the teaching piece of it is covered very well in either a certificate or some other tool for these busy clinicians. If they want leadership and research skills, really good leadership and research skills, they need to go to the next level. I just think these very busy clinicians who are very stressed today, at least I'm speaking very US centric right now, need to, like I find if they just want to do their teaching skills better, their educational theory teaching skills, they can manage with the certificate and be a better educator.
Mm-hmm.
Just a thought,
Yeah.
I'm bringing a reality in. I mean, I'm dealing with people that, I have to have like a melting pot of things because nobody's the same and everybody wants something, but how to give them what. And sometimes that's a temptation. The certificate is a temptation to go on to the master's or the PhD. Sometimes you need to whet their appetite. They can't jump into that big thing right away, but they still get an amazing skill set early on. And they're like, wow. I just had that with actually a nurse practitioner and a physician in my master's program. They were only going to do the certificate. And after one course said, that's ridiculous. I'm doing the whole master's. And both of them already had master's degrees. So I think whetting appetite is a recruitment tool. And we have to think about recruitment in the US because we have a lot of competition here, a lot. And as I've said in the chat over and over, these programs are costly in the US because the way the tuition dollars run in the US.
Thank you, Alice. Yeah, really useful comments. Maura?
Yeah, I thought your comment about people not necessarily having teaching experience was interesting. As a clinician, I often feel probably unjustified, but feel sometimes when I'm working with people in MHP who don't have a clinical background, maybe in the same way is how can you understand because you've never cared for patients? And I think that kind of going back to the comment about, generalists versus specialists, we can either expect that people have done it all and have every different perspective and experience as a clinician, as an educator, when they go into a PhD program, or we can embrace and accept that there's going to be a variety of people. Generally, what I've seen is either people primarily with a social science background or with a clinical science background, although certainly some variations to that. And we can either kind of embrace those differences, but recognize that they may also lead to different career paths. As I'm starting to finish my PhD and decide, do I want to stay what I'm doing? Do I want to make changes? A lot of the positions I see for PhDs, I think would not utilize my clinical background, not meaning I need to take care of patients, but the experience that I have as a clinician, I would want to find a position where I can, bring those two worlds together, and ones that are just about, assessments and, director of assessment and things like that don't feel like a right fit. So I think Chris's comments about generalists versus specialists and thinking about how we can ensure that there is an ability to kind of customize what that PhD experience is going to look like to really fit the type of individual that comes into the program.
Mm-hmm. Yeah, and I would acknowledge all those people are different. I do recommend sometimes, and decades ago, I had a medical background, but I still really like to, every once in a while, spend like a day on a clinical ward or in the OR just to observe and to validate ideas of what's going on, really. Just to make sure that you're not deviating and not looking like being in an ivory tower. So that's important. And I would also, I appreciate talking with students. I do exit interviews for medical students when they finish their medical school. And there's such rich conversations that I have to have me understand what's going on in medical school. I couldn't do without, really. So I think, so the clinicians would really, they sometimes have simplistic ideas of education or educational mechanisms that they will benefit from more deepened educational science. But also the educational scientists would need to understand what health professions education really actually is. Yeah. John, we're approaching the last 5 minutes of the webinar.
Well, sorry, this is, I guess, another existential reflection. So I'm reminded that when we collect data, whether it is a Delphi technique or other kind of research design, that we know what data we are collecting and what's included, but we often don't think about what's excluded. You know, what are we missing through the limitations of our research? And that jumped to me to my observation over my experience is that I have had colleagues both in departments of medical education or offices of medical education and elsewhere that are not medical education retrained. They're social scientists. They're neuropsychologists. They are philosophers. They're public health profession, and they bring a much different perspective, a wide perspective of knowledge that I sometimes would fear that a PhD in medical education, medical or health professions education narrows to a degree that we're maybe shooting ourselves in the foot a few times. Just, you know, just curious. You know, I'm just curious. I mean, because I came from a background of straight ed psych and sort of fell into medical education through my dear friend Reed Williams, and so we bring different perspectives to that table. I don't know, just curious.
Yeah. So yeah, I fully agree with that, and we're not looking at any way that we should make people identical because of their training in a health education PhD. So we should value their differences, but it's just like interprofessional education. So IP, it's like defined as that you understand others. No, I can't remember the definition exactly, but it's knowing other people too and knowing their background to be able to collaborate. So you have to have some basic sense of what people bring to understand them to communicate well. So yeah, I think it touches on the same discussion of generality and specialty. Good. Yeah, unintended consequences, Gary. Can you think of one? Yeah.
Well, all I can think of is that assessment frameworks derive a lot of the education that goes on. And so if we're setting up something that is going to be a framework for expected work products for people pursuing a PhD, then I think no matter what, some people may look at that as this is a one-size-fits-all sort of thing, and won't be such a good thing. Because like John said, you know, we've all come from a variety of different backgrounds and ended up in health professions education in some way, shape, or form. And so even though there are programs designed for this now, there's still a lot of people who come at it from different angles. And I think it creates a richness and a tapestry that can't be untapped. And so my concern would be you know, something like this might inadvertently cause people to think that this is a type of thing that they can look at and say, oh, this is what we need and what is expected of everyone, and could potentially limit us in some way, shape, or form. So I think it's good. I like the idea of having some standards for sure. And Olle, you know my contention with EPAs, because the whole notion of entrustment is one of those things that I find sketchy sometimes, just because I think it's in the eye of the beholder. But I still think that having some sort of framework is a good thing. I just want to make sure that we aren't using it in a way that could be a club, or some people might try to use it as a club.
Right. Elitist.
Well
Are you talking
well
about,
put.
you didn't use the word elitist, Gary. Are you talking about let's, you know, like I'm elite because I did this, and, you know, you want to be careful with that. But look, a PhD is elitist in my opinion. So it's hard, you know, but I don't know, you know, to me, the work of a PhD is pretty elitist with a quality. I'm assuming quality. I always assume quality. So that I put a comment in the chat about IPE. I can't stress enough that the challenge and the time and the effort to make IPE work in my master's level program is exhausting, but worth it. Because in the end, the learners are all benefiting through that struggle together, to be respectful of others' ideas, to be respectful, just like they have to do on teams. So to me, I don't know, I'm glad I'm doing it, even though it's, you know, a huge amount of work.
But I agree with what you're saying there, Alice, and it kind of ties back into what Olle was bringing up earlier, was that these could be used as more aspirational than
Right.
definitive.
Yeah. So I'm mindful of the time, and actually we're over the time now. So thank you all so much for a really rich discussion that really helped me and Roghayeh, I think. I'll give you the last word, Roghayeh, but really helped us to think about, also maybe shape somewhat of our discussion paragraph of the paper, to give some perspective to what we find, and not present us, we're definitely not going to present us that this is the end and all of HPE training or something. That's definitely. So Roghayeh, would you want to have the last word here?
Thank you so much, everybody. Actually, the discussion was very informative to me. Yeah, I will think about that, and yeah, that was very helpful. Thank you so much for everybody.
Okay.
Thanks, everyone.
Thank you, Gary. Thank you. Yeah.
Good to see so many friends. Yes. Yeah. All right, Gary. So this is a recording. Can we receive the recording?